Hi guys, I am Dr. Priyanka Mehta, obstetrician, gynecologist and women's health expert. So I welcome you again to this channel for health and wellness for all, especially for women. So this is going to be the last few weeks of December and 2020, and we are going to be moving into January 2021. So January is a very special month because it is the cervical cancer screening month. And for doing the cervical cancer screening, you have to first understand what is the cervix. So getting back to the anatomy of the female body, if you remember, you have the uterus, and below the uterus, the lower part of the uterus is called the cervix, and this part is called the vagina. So we need to do the screening test for cervical cancer. That means cancer of the cervix. The lower part of the uterus can develop a cancer which is called the cervical cancer. And in healthy women, in those who actually do not have any symptoms, we should ideally start a cancer screening test which is called the PAP smear. It should be done at least 2 years after the first age of intercourse. So if the age of intercourse is as early as 18 years, then we should start doing the PAP smear from 20, or at least if the age is say 25, then at least from 26 or 27 you should start doing a regular PAP smear. So the guidelines are different in different countries, but on an average, ideally every 2 years or 3 years you should be doing a PAP smear test, so that your gynecologist is going to take a look at your cervix at the lower part of the uterus, and then we take these cells. So how we do it is, when you go for your gynec examination or for your routine checkup, you should be going ideally when you do not have a period. So after the period you can plan a visit, and also you should not have had intercourse for at least 24 hours or used any vaginal cream, so that we get a correct report. So how it is done is, you're going to be made to lie down on the couch, and then one comfortable speculum is used, which is used to open up this lower part or the vagina. So this is usually closed, and that speculum is used to open up the vagina, and then one small brush or a spatula or is just taken, and then it is rolled around this lower part, so that we are able to take the cells from the cervix, and then we send these cells in a liquid that is called the liquid based cytology, and then it is sent to the laboratory. The report can come as absolutely normal, or sometimes if you have some kind of an infection like a fungal infection or a bacterial vaginosis, there could be so many kinds of infection. It comes as an infection or inflammatory smear, and we treat the infection and repeat the test. Not everybody who does this test, the report may not come as cancer, but we are sometimes able to pick up even pre-cancer, because there is a period of at least 10 to 15 years when this pre-cancer problems can develop into full-blown cancer. So the reports can also come as an atypical report, or a LSIL, as we say, a low-grade report or a high-grade report. So depending on what your report is, if it is normal, you'll be asked to come back after 2 or 3 years. If there is an infection, the infection will be treated and you'll be asked to come back after maybe 6 months. But if there is a low or a high possibility of a cancer developing later on, or there is a doubt that there is a cancer which is happening at that point of time, then you will be advised to do a colposcopy, and they will also do a biopsy depending on what the findings are. So I will be talking to you about colposcopy in another video, but do remember that PAP smear is something which gives a lot of information about the health of your uterus and your cervix. And if you are married, sexually active, do get a regular PAP smear, probably once every 2 years, and then till the age of 60 to 65 you should be getting it done if you are doing it regularly. Thank you.